A simple softball question to start, thank you. So what are we seeing on the ground in New Westminster, across the country, across the province? We're seeing a very complex narrative playing out. I've talked about this often. When I talk about the criminal justice piece, my piece, the police piece, it's a reactive system. To touch on what Minister Young talked about regarding secure care, people ask me, well, what's your opinion on secure care? I say, well, we have it already. It's the criminal justice system. It's jail. It's prison. So as a society, I think we need to start having serious conversations. Are we willing to just wait until someone's committed a criminal offense, cause serious harm in the community? And that's the time where now they're into my system, the criminal justice system. And for, even though it's well-intended, I mean, that generally just is warehousing people right now. So I also am very supportive of proactive secure care for those individuals that need it. I think it's very important. The key there is how it's going to be actioned. Obviously, as the minister said as well, not everyone suffering from a mental health disorder needs secure care. But there's some individuals out there that are a danger, serious danger to the community and to themselves. And I think it behooves all of us to look at ways to get those people help to protect the entire community. Specific to New Westminster, we're, again, I refer to us often as a core city, similar to Vancouver, to Victoria, in that we have a dedicated downtown. We're only 15 square kilometers here, but obviously we're in the geographical heart of the Lower Mainland, 5 SkyTrain stations, RCH, a significant health facility and a mental health facility as well, Douglas College. So it's a very busy community. It's a very busy police department. We have about 115 officers dedicated to the city, but as with other police departments, we are having some staffing challenges. And again, member wellness and staff wellness is very important to us. So, we are seeing, in our industry, a better look at members, how we treat members, allowing them to have time away, and certainly for them to come forward and put their hand up if they are struggling themselves. I think police officers and probably first responders in general are 3 times as likely to commit suicide. So that's something we're very much aware of. We in our department did a member wellness study 2 years ago. And while we were doing well in areas of PTSD, anxiety, and depression, there was a huge number of burnout. Clinical burnout was huge. It was about 1/3 of our members were suffering from clinical burnout. So that's a big concern for me, because if my members aren't well, they can't serve the community. We've also done a recent patrol study that looked at what our patrol members are doing. And what it showed us was our members are obviously extremely busy. 92% of their time is basically being occupied. That doesn't account breaks, so that number should be about 80%. And as well, what we're seeing is probably 50% of our call load is not police primary calls. So that's social disorder, calls that don't necessarily fit in the traditional policing model or crime model, but there's no one else. And I'll give you a really quick example, and this isn't an indictment on any group or agency. We arrested a federal parolee on Wednesday at about 4 o'clock at their request. We arrest this individual for reasons I won't go into. This individual had to go to the hospital. The Federal Corrections was unable or unwilling to come out and take custody of this prisoner. So I had a police officer guarding a prisoner for 27 hours. So my options there are to call someone out and do that work with an already restrictive budget, or to have a dedicated member of my department, my patrol members, no longer able to serve the community. So that's just one example, and that's not, again, it's just a structural challenge in that the funding models, and it's always falls to the police because we're there, we're open, we're 24/7, we're the tip of the spear. So we're reacting to these things, and oftentimes it just falls on us. We can't just walk away from that situation. Again, we talked a little bit about COVID. I think we did see an increase probably in our street population with COVID. Anecdotally, again, the information we had and what we were seeing was the border was closed, drugs coming into the country were restricted, the prices were going up, and Minister Young probably saw this firsthand. A serious increase in violence in the downtown east side and even in the North Surrey area. So people that were not interested in being part of that or being victimized by the violence, we saw them coming to different communities in the Lower Mainland. I'll just do a quick shout out to our own community here. I think we do provide a lot of care, and purpose is part of that. We're not going to arrest our way out of this situation that we face. There is a serious component there for the criminal justice system. We need to really look at the upstream drivers of crime and public disorder and address them. And quite honestly, I think the challenges that we're facing as not just this community, but in the province, we have a bit of an alignment problem and a coordination problem. The alignment problem is, I don't know if we all understand or we all agree, and maybe we don't have to, but what's the best pathway forward? I think we really need to start to figure that out and get some smart people, some subject matter experts in the room, and have them come up with some solid solutions and a pathway forward. And again, the coordination problem. We have a collection of nonprofits, NGOs, government agencies that are all well-intentioned and trying to offer good services. But I think better coordination of those services would benefit us across certainly the province. And really, let's get down to the business of caring for these individuals that need the care. Thank you.
Thank you very much. Maybe Linda, I'll come to you next. Could you tell us